Monday Morning House Calls, sponsored by UK Healthcare.
Welcome back to Mountain News this morning. We're joined by Dr. James Shoptaw with UK's Gill Heart Institute. Thanks for joining us.
Yeah, thank you for having me.
And we're talking today about peripheral vascular disease. What is PVD?
Peripheral vascular disease is generally we're talking about peripheral arterial disease, which is simply a blockage in a peripheral artery causing decreased flow to the extremity, whether it be the arm or the leg, or cerebral vascular disease would be the carotid artery would be blocked and would cause decreased flow to the brain.
And of course, what are the issues when you have that kind of a blockage there?
Generally presents with either pain, paresthesia, or numbness, or sometimes it can present with an acute embolic event like malperfusion of a digit, like you may present with a blue toe, perhaps, or maybe frank gangrene, blackened discoloration of the foot. But we would implore the patients to come in early if they have pain in their limbs with walking, if they have numbness or tingling in their legs, or if they have discoloration of their legs, or if they have an ulcer on their leg that will not heal. We would advise them to come on in.
Those are the kind of things that are going to be symptoms of this, right?
Oh, yes, sir.
Okay. That being said, what kind of therapies, what kind of treatment is there if somebody has this kind of disease?
Well, I mean, the first thing is risk factor, modifying the risk factors. For instance, the risk factors for coronary disease and for peripheral arterial disease are similar. Cigarette smoking, sedentary lifestyle, diabetes mellitus, hyperlipidemia. Those are some of the risk factors. So if we could get the people to stop smoking, that would be the number one impediment to them getting better, basically.
And of course, you know, smoking, not eating right, various other kinds of unhealthy lifestyles. I mean, those are the kinds of things that are kind of obvious. You know that that's going to cause a health problem somewhere. Anything that people don't think about that's going to prevent this kind of issue?
Well, I mean, you commonly don't think that your genetic history has anything to do with it, but there are people that have predisposition to this kind of disease regardless of the risk factor profile.
Okay, and of course you can't really do anything about your genetic profile, obviously. Yeah. That being said, anything else that you can do to prevent this kind of thing?
Well, I mean, you can exercise. We'd like people to walk an hour a day. Mm-hmm. They can do it in divided segments, 30 minutes in the morning, 30 minutes in the evening. The body mass index, controlling obesity in this country. A few years ago in London, Kentucky, we studied the kids from K through the 4th grade, and when we started the study, the incidence of obesity was 32%, and at the end of the study, the incidence of obesity was 37%. So obesity is a dramatic problem in this country.
All right. Thanks for joining us. Mountain News This Morning continues in just a moment.